Hi.
So could you start by telling us about exactly what it is that you do at First Psychology?
Okay. So I'm a clinical psychologist. So I'm trained to work in adult mental health with older adults, with children and with a learning disabilities population as well. But at First Psychology, we just focus on working with adults who present with a wide range of difficulties, probably predominantly low mood, anxiety, and sort of and that's it.
Brilliant. And how long have you been a clinical psychologist for?
So I've been fully qualified for about 8 years now. I think that's right. Yep. But I've worked in psychology for almost 20 years. So, but it can take quite a long time to get to the point of full qualification.
Absolutely. And how long have you been with First Psychology?
I've been working with First Psychology for about 3 years now, just coming for 3 years next month. But I do 1 full day and 1 evening a week, and I work in NHS as well.
And when did you first decide this was the career you wanted, and how did you become interested in becoming a clinical psychologist?
Oh, I'll need to cast my mind back. When I was graduating from uni and I had studied brain injury from my undergraduate thesis, and decided I would try and get some work experience in that field with a view to going on to do the training in clinical psychology, which is a 3-year doctorate training where you work at the same time as studying. And you need quite a bit of both practical work experience and perhaps some further qualifications as well. So I had a bit of a roundabout route to getting onto it because I applied for it, had relevant experience as an assistant psychologist, is the role that you go for after university, and couldn't get onto the course even though I was just trying for several years. So I went off and did a master's in work and organisational psychology instead, and started working in that field for the DWP in the civil service. But it helped me to realise when I was in that role, which was predominantly sort of assessment based and very much with a work focus, that I wanted to help people in other ways as well, and it not just about their careers and their jobs, but other aspects of their life as well. So I decided at that point to go back and apply for clinical psychology training again, and go on at that point, despite the fact that I had done nothing in between that actually gave me very relevant additional experience. Had gone away and done something else, and that. So whether they like that, I don't know.
So did you find it quite a difficult job to get into? I mean, what kind of qualifications and experience was required for the role that you're in now?
Yeah, so it is difficult to get into. There's a lot of competition. There's a lot of people coming out of undergraduate degrees and are keen to go in and do clinical psychology. So there's definitely an expectation that you would either get some additional research experience working for universities and things, or get a job in the NHS as an assistant psychologist, or maybe for another voluntary agency as well. But the reality is now that most people have some sort of additional postgraduate qualification as well, masters and PhDs and everything as well. People I trained with, there was quite a few who already had a PhD. So you do have to be quite dedicated. You have to be willing to get that additional experience before you can go onto the course, which is fair enough, I think, because you go straight into working on placement when you're doing the training. So you need to have some experience of working with patients, and I think I had done voluntary experience and things as well, which I think is very valuable. So you do have to put the time in, and be quite clear about what you want to do, because it's a lot to do if you then just change your mind at a later date.
Yeah, sounds like it. So how many clients do you see in a typical week then?
So I do, as I say, like 1.5 days, so I'd probably see 8 to 10 clients over that. But if I was here 5 days a week, I'd probably be aiming for about 25 clients a week, something like that.
Okay.
It's a bit slightly different from NHS work where you have obviously other stuff that you work on, other projects, meetings to attend, and then there's a lot more administrative tasks to do as well in NHS working. Whereas for psychology, there's much less of that. There's a lot of email communication and things like that, but we don't get in contact with GPs and things unless it's absolutely necessary. So it's more about just the time working with the client.
Okay, great. And what have you found most rewarding about being a clinical psychologist?
I think it's just being able to create change and create hope for people who are coming along. It might be a fairly mild difficulty that's caused them problems throughout their life, and they've just not had a structure or known about the approach to manage that, and it can sometimes be fairly straightforward to apply that. I guess, when you're on the outside looking in, it's easier sometimes to see the best approach to take, and for the client coming along who's in the middle of it all, it's hard to see the wood for the trees, or the trees for the wood, I don't know. So I think it's being able to make change for that person who has just not known how they're going to deal with this problem, and actually in a relatively short space of time you can make quite a big change for them. Not necessarily overnight, you can't do it overnight, but it's sort of just applying the principles that you brought and applying the therapies that you know have got an evidence base for whatever the difficulty is that they're presenting with, and you can always make some sort of difference. Again, it's not about curing or completely taking away a difficulty for somebody, but again it's just about helping them to find a way of manage that more successfully so that it has less impact on their day-to-day functioning and so on.
Yeah. And what would you say is most challenging about your role?
I think again, the difference between the NHS and for psychology, so in the NHS you generally have quite a bit of information about a person before they come along to see you. You've received a referral from somebody that's detailed the difficulties, and because I work in a hospital as well, in an acute setting, so, you can access other information on the system and so on. That gives you quite a good picture of somebody before they come along.
Yeah.
And for psychology, that's much more unusual, so we might have a very rough indication of what's bringing the person along, but more often than not you don't have that information at all. So it's one of the appealing aspects of the job as well. It's challenging in the sense that it keeps you motivated, and it sort of keeps your attention, and you have to make sure that you're on the ball and that sort of thing. But it's challenging in the sense that you don't know what somebody's going to say when they come in, so you have to just be prepared to adapt your assessment, I guess, at quite short notice. You can't just have a standard set of questions to ask. You've got to be able to adapt that depending on the difficulty that they're bringing along. What else would I say is challenging? People do have quite high expectations as well sometimes. Not that they're not entitled to have that, they should be entitled to look for significant change, but sometimes they might expect that that's going to happen quicker than you can actually provide in reality. So there's just a bit of managing of those expectations that has to be done to begin with, but I think more often than not you can do that quite quickly, and people are fairly realistic.
Great. And is being a clinical psychologist, is it what you expected, or are there things about it that have surprised you along the way? I would say it's what I've expected. The breadth of training that you do, as I say, it qualifies you to work with a wide range of people, and so within that you see a really wide range of presentations, and you hear a lot of stories and meet a lot of people from a huge range of different backgrounds, so I think that prepares you for anybody coming along and what they're bringing. So it would be fairly unusual for me to be surprised, I think. Okay. And do you have any areas of expertise or specific interests?
A lot of my experiences with brain injury and other clinical health, physical
presentations as well, whether that be again on the sort of neuropsychological side of stroke, which is what I do in the NHS, to working with pain or lots of other physical health conditions as well. So that's probably a more specialist area for me, but you know, I've worked in adult mental health and things as well, so sort of working with depression and anxiety is my bread and butter, really.
Yeah. Okay. And how do you keep up to date with the latest research in all these areas of clinical psychology?
Well, it's hard at times when you're working clinically. You do have to set aside time for it.
Yeah.
You know, we have CPD requirements and things that we have to keep up with. So I'm a member of the British Psychological Society, and that you know, you get various publications and things that come along from them, and you can access their website, which they've got lots of different you know, sections summarising all recent research, and online now as well you can access so many journals and different publications as well. So it's a lot easier than it used to be, and you didn't, you know, where you would have to go along to the library and search for this, you know, paper version of a journal and sit and read that and hand it back in. You can access things online and much more accessible now. And I try to attend as many different events that I can as well, again through the BPS, often set up various free events that you can go along to. But you need to set aside the time for it, or it doesn't really happen.
Yeah, I can imagine. And are there any other areas of psychology you'd like to explore in the future?
Well, I think I said I've got the other qualification in work and organisational psychology as well, which I wasn't drawn to the sort of commercial side of that, but I certainly enjoy working in terms of sort of mental health in the workplace and helping people in that sort of situation. So I would maybe like to do a bit more of that in the future, but I think that, you know, gels quite well with the general other mental health work as well.
Yeah. Okay, and do you have any helpful tips or advice for students like myself or other people interested in this line of work?
I would say probably be prepared for a long haul with it. You know, there's plenty of people do their undergraduate degree, a couple of years relevant experience, and then get straight onto clinical training. So it's not that it's not possible, but my experience for most people it takes a bit longer than that. I would say, you know, get some voluntary work. It doesn't need to be, you know, a huge burden. It doesn't need to be, 4 days a week or anything like that. It just needs to be a fairly small amount, you know, and not something that should feel like a huge burden for you. You should enjoy it. So I would always encourage people to look around with that and don't just do the first thing that comes along, you know. Do a bit of research and try and find something that you think you will enjoy, but that also meets those other needs of, in terms of the experience that they might be looking for you to get onto training or to work in the NHS. Yes, and just do a lot of reading, try and have a good breadth of knowledge, and you know, if you do a job in one area and decide that you're not sure if that's for you, you know, realise that that's not lost experience, that it's not a waste of time. You will always have learned something useful from that. There will always be something transferable from that.
That's true.
You know, and I know that from all the different things that I worked in, that I'm now not, you know, worked with kids before and things, and I don't work with kids now, but I've still retained a huge amount from that that's really useful. So if you go in and do something and then it sort of a lot of the assistant psychology jobs and things are only short-term contracts, so you can feel like, oh, I've gone and done that for 12 months and then I'm not going to be able to use that again, but you will always use something from it, and it's always a good experience to have.